Imagine being arrested not because you're a criminal, but because you're sick. Imagine hearing voices lost in paranoia wandering the streets, and instead of being helped, you're handcuffed, booked, and jailed. This is not rare. This is not fiction. This is daily reality for thousands of Americans with mental illness. As a psychiatrist, I've worked behind the locked doors of jails, courts, and forensic hospitals. And I've seen firsthand what happens when mental illness meets the criminal justice system. It's not justice, it's not treatment, it's a broken cycle. And today, we're going to break it down. The criminalization of mental illness. Let's begin with a simple truth. Jails and prisons have become America's largest psychiatric institutions. An estimated 2 million people with serious mental illness are booked into US jails each year. About 25% of inmates in local jails and 15% in state prisons live with serious mental disorders like schizophrenia, bipolar disorder, or severe depression. Many were arrested for non-violent, low-level offenses, trespassing, loitering, disturbing the peace, behaviors often linked to untreated psychiatric symptoms. So how did we get here? A brief history, how we failed. In the 1950s and 60s, America began deinstitutionalizing mental health care. Large psychiatric hospitals were closed. The goal was to provide care in the community, not in locked wards. But the promised funding and services never fully materialized. As a result, people with mental illness were left with no place to go. Many ended up homeless, disconnected from care. Police became the default responders, and jail became the holding cell for untreated mental illness. Policing mental illness. Today, police officers are often first responders to mental health crises, but they are not trained psychiatrists, and the result is often tragic. In the US, at least 25% of fatal police shootings involve people with mental illness. Many crises escalate because of miscommunication, fear, or misunderstanding. A person in psychosis may appear aggressive, non-compliant, or erratic, but they're not a threat. They're sick, confused, or terrified, yet they're often treated like criminals. Inside the jail, what really happens? Once someone with mental illness is arrested, they enter a system that is not equipped to care for them. Jails are loud, overstimulating, chaotic, the worst possible environment for someone with psychosis, mania, or PTSD. Inmates with mental illness are more likely to be placed in solitary confinement, victims of violence, given disciplinary infractions for behavior they can't control, and most jails have limited psychiatric services. One psychiatrist for hundreds of inmates. Delayed medication access, no therapy, support, or stabilization. Mental illness worsens behind bars. It's not treated. The revolving door. After weeks or months in jail, individuals are often released without housing, medication, or follow-up care. What happens next? They relapse, they decompensate, they get rearrested, often within weeks. It's called the revolving door. From street to jail, to hospital and back again. And it's fueled by poverty, stigma, and a lack of coordinated care. Special populations at greater risk. The criminal justice system does not affect everyone equally. 1. People of color, Black, and Latinx individuals are more likely to be arrested, incarcerated, and misdiagnosed. Systemic racism adds another layer of trauma and injustice. 2. Homeless individuals. Mental illness and homelessness are deeply connected. People are jailed for sleeping in parks, panhandling, or trespassing, instead of being offered shelter or services. 3. Veterans. Many live with PTSD, depression, or substance use disorders. After serving their country, they often end up in jail cells instead of treatment programs. 4. Youth with mental illness. Juvenile justice systems are overwhelmed with kids who need therapy, not punishment. Trauma, ADHD, conduct disorder, and early psychosis are often unaddressed. These are not criminals. They are people, abandoned by broken systems. Mental health courts and diversion programs. There is hope. Across the country, some jurisdictions are reforming how mental illness is handled. Mental health courts, specialized courtrooms where judges, lawyers, and clinicians work together, focus on treatment over punishment. Offenders agree to enter mental health programs in exchange for reduced sentences or dismissed charges. Crisis intervention teams, CIT. Police officers receive mental health training, learn to de-escalate crises, recognize symptoms, and connect people to care. Studies show CITs reduce arrests and improve safety. Diversion programs, pre-trial interventions that redirect people into mental health treatment, reduce recidivism, and save taxpayer money. These are steps in the right direction, but they're not yet the norm. Chapter 8. As a psychiatrist in forensic settings. Working in forensic psychiatry changed the way I see justice. I've evaluated individuals found not guilty by reason of insanity. I've treated patients who committed crimes during psychosis, who recovered and were horrified by what happened. I've seen people stabilize, become thoughtful, remorseful, hopeful, and I've seen others deteriorate, lost to a system that offers punishment, not care. Mental illness does not excuse crime, but it must inform how we respond. Chapter 9. Why incarceration is not treatment. Let me be clear. Jail is not the place for mental health recovery. It cannot replace psychiatrists, psychologists, medication, case management, housing support, community, reintegration. And yet, we've made jails the dumping ground for the mentally ill, not by malice, but by neglect. We must stop using incarceration as default mental health care. Chapter 10. The cost, human and financial. This broken system isn't just immoral, it's expensive. It costs more to incarcerate someone with mental illness than to treat them. Jail stays are longer, medical needs are higher, recidivism is common. And the human cost? Lost lives, broken families, missed opportunities for healing. We're paying the price in lives and dollars for a system that doesn't work. Chapter 11. What a better system looks like. What would justice look like if it were truly trauma-informed and mental health-centered? 24/7. Crisis response teams that include clinicians, not just police. Community-based psychiatric facilities with beds, not bars. Supportive housing for those with chronic mental illness rehabilitation, not incarceration. For non-violent offenders, wraparound services, therapy, vocational training, case management. Justice and compassion can coexist, and must. Ending a call for change. We are at a turning point. We can continue locking up those who need help, or we can choose a better way. Mental illness is not a crime. It is not a moral failing. It is a health issue and deserves a healthcare response. If you've watched this far, I ask you to share this message, advocate for mental health reform, vote for leaders who prioritize diversion and treatment, support organizations working to end criminalization. Let's stop punishing pain. Let's stop confusing illness with criminality. Let's build a system that sees people not as problems, but as human beings worthy of healing, dignity, and hope. Thank you for listening.